Hi, good evening and afternoon, everyone. Thanks so much for joining us for our Locum Tenens, Why Locum Tenens After Residency and Fellowship webinar today. We will be recording this webinar, so if you need to leave early or if you couldn't make it today, we will be following up after this with the recording so you can watch it at a later time. During this webinar, feel free to ask questions that you may have in the chat, and we will answer those questions at the end of the webinar. Again, thanks for joining us. The webinar today is presented by myself. I'm Sara Abitbol. I'm a physician representative with otolaryngology and allergy team here at CompHealth. And my teammate, Courtney Mutema, she's also a physician representative in otolaryngology and allergy at CompHealth.
Hey, thanks for coming.
On today's agenda, we're going to go over what is locum tenens. We're going to look at why work locum tenens specifically for graduates, recent graduates of residency and fellowship. And we know that you have a lot of choices out there, so we're going to cover the many benefits of choosing to work with CompHealth for your locum tenens needs. And at the end of our webinar, we'll provide you resources that you can take away for further information. Now, to start it off with, you may not know what is locum tenens, or you may have heard of it from other colleagues or other physicians. In Latin, locum tenens means to hold the place of, but to doctors, NPs, and PAs who practice this way, and most importantly to the patients who count on them, it means so much more. And locum tenens can be found in a variety of different environments. Locum tenens are supporting facilities, hospitals, clinics nationwide. And locum doctors, nurse practitioners, and physician assistants step in and cover shifts as short as 1 day up to a full year. So it just really depends on the assignment. It could be covering for vacation, vacancies, maternity leave, you name it. And since its creation in 1979 by CompHealth, locum tenens has gained popularity from providers and appreciation from hiring managers, taking its place as a really important component of the healthcare industry today. Locum tenens is a growing industry that's loaded with opportunity. Did you know that locum physicians work in all 50 states and cover 75 specialties, including ENT, and more than 40,000 physicians work locum assignments annually? It's a $4 billion industry. Yes, you heard that right. And it's growing. And 94% of US healthcare facilities use locum tenens each year. So let's watch a short clip and we can learn more about what's in it for you.
Why try something new without knowing what you're getting into? We think there's a lot in locum tenens for you. Like extra money in your pocket, a real plus when you're leaving residency and facing student loans. How about working in different settings? You'll make a smarter decision when you take a long-term position. And if a locums assignment turns out to be your just right job, we'll help you turn it into a permanent one. Down the road, if you find yourself between jobs, locums assignments will fill the gap while you look for something new. And they're a great way to take a break when the daily grind gets you down. If family responsibilities start stacking up, don't forget that locum tenens means extra cash for kids, vacations, or your midlife want-to-haves. When you're ready to cut back on full-time work, locum tenens gives you great flexibility. Assignments across the country mean you can work a little, travel a little. And it's a great way to give back. VA hospitals and Indian health services always need your skills. Ready to give locum tenens a try? Then give CompHealth a call.
Awesome. So you can see that there are many different reasons why physicians choose to work locum tenens. One of the biggest reasons we see is you get control over your career, and that is powerful medicine. Every year, thousands of doctors discover the many benefits of working locum tenens. And our recruiters, like myself and Courtney, will we excel at connecting you to jobs that match your individual needs. Now Courtney is going to take over. She's going to explain to you more about how locum tenens benefits can be tailored to your goals.
Yes, thank you, Sarah. Hi, I'm Courtney, and I wanted to say thank you really quick. We know it's a super busy time for you, finishing up your training and getting close to graduation. So thanks again for taking a little time to learn about locums. And the benefits of locums can really be tailored to your goal. Recently, I've spoke to a few physicians that mentioned they wish they're further along in their career, but they had mentioned that they really wish they had known about locums earlier on and how it could help them achieve goals. And this kind of got Sarah and I thinking, you know, it's a great time to chat with doctors who are about to be completing their training, their residency and their fellowship. So the whys behind locums, one of the biggest, I think, would be for supplemental income. This one kind of speaks for itself. It's really a great way that you can get a jump start on paying down student loans, paying off debt. Many contracts allow for moonlighting on the side. So even once you start your permanent position, you can still work locums on weekends, vacation time, holidays. It's just a great way to earn some extra cash. Another way to supplement and kind of help yourself out would be if you're planning on opening your own practice. A lot of physicians right out of training and residency decide to open their own practice, and it takes a lot of time to get things up and running, a steady flow of patients. So locums can really help supplement your income during that time and help alleviate stress of overhead. And I actually just recently, over this past holiday season, Christmas and New Year's, worked with my first physician that was actually still in fellowship training. He actually had reached out to me off of an email he had received, and he was just inquiring about locums, but he said he was still in his fellowship, so he was unavailable. But the program that he's in had recently started asking him to take call at multiple hospital locations. And with him working and living in a city, he always had access to public transportation. He didn't really have a need to have his own vehicle. But now with them wanting him to visit multiple hospitals or cover multiple hospitals, it was a little bit harder with travel. So he was thinking of purchasing a car. Excuse me. So I actually helped reach out to his administration department and the program director. And we had a couple conversations and a couple emails back and forth, and they actually authorized him to take a vacation during his fellowship, which is unheard of. Typically, you're working a ton of hours during your residency and fellowship, but he was able to take 10 days off over Christmas and New Year's and work those 10 days as a locum at a facility. And it worked out great because he even got extra pay covering 2 holidays, and he was able to purchase a vehicle. And he just reached back out to me. He's about to finish at the end of June, and he's taking June. Well, the end of June, he's going to do a little traveling in Europe, and then he's going to work during the month of July and August before he starts his perm position. So another why would be for filling employment gaps. And this is something that you can do now and down the road. It's very common for there to be a gap between graduation and starting your perm contract. There's also often delays with licensing and hospital privileging. It's a time where medical boards, licensing boards really get bogged down because so many new physicians are coming to look for or apply for a new license. So if there's delays or if hospital privileging is delayed, locums is a great way to bridge that gap while helping facilities and communities that are lacking ENT coverage. Last summer, I did work with a doctor. His name was Dr. Burdett. And he said that he was planning on going straight into a perm contract. And again, because of a licensing delay, there was a gap he wasn't expecting. And he wasn't really sure what he was going to do with his downtime, because you go from such the hustle and bustle of residency, working a gazillion hours, to having a 2 or 3 month gap. He wasn't really sure what he was going to do. So we were able to get something set up, and he worked for most of July through August and into the first part of September. And here's what he had to say about his time as a locum. He really enjoyed his time as a locum. He felt it was a great introduction to being attending. He had time to grow without the worries and stress of a practice and of billing. He actually wishes he had more time to spend as a locum. And he is another physician that just recently reached out and is actually going to use some of his vacation time this year to go back to the facility that he's already licensed and credentialed with from his stint as a locum there last summer. Work-life balance, enjoying more flexibility. You can work as much as you want or as little as you want as a locum. You don't have to worry about admin or hospital politics. And many physicians will utilize locums to allow them to take their time to find the right permanent position, especially if it's in a subspecialty of ENT, or if it's in a state that you have your heart set on moving to that maybe has more of a saturation of ENTs, and it takes a little longer to find that perm position. You could absolutely work as a locum and work, an example would be working like 2 weeks on, 2 weeks off, so that you have flexibility to spend time focusing on finding that right position that you want to commit to long term. Have that flexibility in your schedule to be able to go on interviews, but also be working, 2 weeks out of the month and still earning income. So just really having that flexibility to be able to move about and spend time finding the right fit for you. So gaining experience and expanding your skill set would be another reason why to work locums. Exposure to different practice settings, different EMR systems, different equipment, just really becoming more adaptable to new and changing situations in different settings. Traveling the country, discovering new places. There's a lot of communities, a lot of rural settings that are underserved communities that are lacking ENT coverage, and just being able to discover new places is something that would be nice to be able to travel and work at the same time. Dr. Trevor Cabrera, he's actually not an ENT. Most of the other doctors I mentioned, we've actually worked with and they are ENTs, but Dr. Trevor Cabrera is a pediatrician, and he decided to try locums right out of his residency. And he ended up enjoying traveling and being a travel doctor so much and helping out in underserved communities that it kind of became his thing. And he was only anticipating doing it for a short period of time, but he's now been doing it for several years. He called himself the travel doctor, and then he just recently changed it to the nomadic pediatrician, and he created a little blog, and he has, you can follow him on Instagram, you can connect with him on LinkedIn, but he's got on several locum assignments with CompHealth. And he really has enjoyed traveling and being a travel doctor. At the end of our slideshow or our presentation, we did add under our resources link, a link to a podcast with a really great interview with Dr. Cabrera, where you just kind of get to know what it's like and how his experiences have gone as a locum. And it's called From Residency to the Open Road with the Nomadic Pediatrician.
I love that name.
Thank you.
Nomadic pediatrician.
Yeah. Lastly would be trying before you sign. So making sure that the practice is a really great fit, making sure the environment is good, making sure you get along great with the ancillary staff and it's somewhere that you want to commit to long term. So a lot of our physicians that have started out as a locum found out, wow, it's a really good fit and I could see myself staying here for a longer period of time. And if that's a transition you decide to make after working locums, we can help you with that also. So here's a little video from Dr. Shen and his experience of working as a locum right out of residency.
I was a little afraid that once I was out, becoming a real doctor, attending physician, that I was going to not be ready. And then I thought about it and said, well, I'm not going to just sign up for a 2-year contract right from the start if I'm not going to be ready. What if I don't like the place? I'm kind of stuck in a rut that way and I can't just leave. So locum tenens again felt like the most natural thing for me to do. So I remember prior to my first assignment, I was reading up on things, reviewing things, watching videos, thinking of scenarios when a patient would come in, if I was the only solo provider, what I would do. And then when I actually started my first assignment, it turned out to be pretty straightforward. It was just like my normal day clinic that I was doing for the last 3 years in residency, but this time I had the added, bonus of being my own boss. Finally, I get to make my own decisions. Lots to be said for autonomy when it comes to becoming a physician. When I was a resident, I love having someone watch over me and say, hey, this is not right, do this way. But then when I became my own, became an attending physician on my own, I really, really enjoyed the fact that I was doing this for myself, and I was working directly with the patient without having someone else to kind of make the decisions for me.
So, Sarah, if you want to tell us a little bit more about why choose CompHealth over other companies, there's a lot of choices out there, a lot of options for doctors. So tell us a little bit about why they should choose CompHealth.
Yeah,
Yeah,
absolutely.
absolutely.
Thanks, Courtney. First, before I do that, though, I want to tell you thanks for sharing those stories about your physicians. It really brings these whys to life. There's so many whys. There's so many different reasons why people choose to do locums. And, I just love your story about, one physician's uh, why was initially to get a car.
Yeah.
I mean, how awesome is that? And then he had
Mhm.
that like financial goal, and you really went above and beyond. Calling his administration for him and helping him get those vacation days. I'm sure a lot of our Resi fellows can relate to that, not being able to get those vacation days. So, Courtney, they might all be calling you afterwards. Hey, can you get me some
You go. Yeah.
vacation days as well? But I love it. And yeah, and that's probably one of the biggest reasons, after all, why choose CompHealth. Now, we are the biggest, but that doesn't mean that we care less. We're the biggest names around there. You probably have heard of CompHealth before, but rest assured, we take the time to get to know you so we can really place you in the perfect job. As Courtney's stories have clearly demonstrated. And it all comes down to this CompHealth experience, this personalized service that we offer. We find out what your why is. Is it to get a car? Is it to travel? Is it to have more time with your family? In Dr. Shen's case, is it you're not ready? You don't want to make a big commitment. We learn about that because we really care about you. You're not just a number. But there are so many different benefits for working with us here at CompHealth. So I'm going to share with you some of the top ones that we find, with the feedback that we get from our physicians. One is, did you know that when you work a locum tenens assignment, all your travel expenses are covered? So, that doesn't come out of your own pocket. You'll get your airfare, your hotel accommodation, car rentals, that's all covered for you. Another way that we really personalize this experience for you is you have customized itineraries. What that means is like your travel will reach out to you and they'll ask you what your preferences are for your travel. Do you have a frequent flyer with a particular airline? Do you want to stay in a particular hotel chain? And they're really going to do their best to meet those, you know, requests that you have. Another really great benefit that we've noticed that a lot of other agencies don't offer is that we have 24-hour emergency travel hotline. And that might be might seem like a small benefit, but once you're traveling, and many of you may have traveled, back home recently, you know how the airlines are right now. Imagine just going out on assignment or just coming back from one and getting stuck at an airport and, you don't have anyone that you can reach out to help get you on another flight, or, you get to your hotel late at night, it's overbooked. What do? You have a live person you can speak to here at CompHealth for 24-hour emergency travel.
Yeah, I was gonna say,
Big deal.
Dr. Shin didn't think that was a small benefit. He thought it was pretty big when it was the holidays and there were snowstorms and he got stuck. So
Oh yeah,
it
I
worked out
bet.
great
Yeah.
when he just dialed. I texted him the number really quick and he called and got rerouted. So yeah.
Yeah, it is. I mean, we've heard horror stories from physicians working with other agencies who'll say, I got stuck and, I was late getting there and just horror stories. So it's always nice in this day and age to have a live person you can speak to about problems. And speaking of live persons, you have dedicated experts each step of the way here, not just in travel, not just with your recruiter, every single step of the way. You have, your dedicated coordinator for licensing, your dedicated coordinator for credentialing, for payroll. We'll go over the team and how that works in a little bit, but you don't have just, one person doing everything, or it's not a like do it yourself type of environment. Also included in your assignments is malpractice insurance, including tail coverage, so you don't have to worry about that. And this is all part of the CompHealth experience. This is something that's really unique to CompHealth. We get to know you. You're not a number, and that is a huge, huge benefit and goes a long way. Finally, probably the most important, right? If you want to get that car or take that vacation or pay off those student loans, we pay upfront weekly. And what that means is we're not waiting for the clients to pay us, which can take months upon months. We pay you weekly every Friday. You get a direct deposit, and we guarantee it. You know what your minimum pay is going to be, and that's really nice, especially when you're budgeting. So yeah, here's how the team works. So you meet with a physician recruiter like Courtney or myself. Really, we're more of consultants. Again, we're going to learn more about what your why is, what your availability is like, what you're looking for, and then we can really tailor those jobs that meet those goals for you. And then let's say, you get confirmed for a particular assignment, then we'll get started on licensing if applicable, and you'll be assigned your own licensing coordinator. And this is not going to be a different person every time. You're not going to call an 800 number when you have a question and have to explain yourself yet again. You will always have the designated licensing coordinator, which is really great. And the same goes for hospital privileging coordinator. That's going to be your assigned coordinator, not a different person every time. And then Courtney and I, for example, we could say like the project managers. We're making sure that everything's going smoothly. We're working behind the scenes to make sure that licensing is working. Privileging is on track. Reaching out to you with reminders, we're your go-to person for all of this. Finally, when you're getting ready to go, travel will reach out to you, as I explained earlier, and they'll ask you for your preferences, work with you to book your flights, your hotel, but they do it all for you. You don't have to go late at night on Expedia or anything like that and, book your own travel. They take care of all of those arrangements for you, put an itinerary in the app, and you're all ready to go. And then finally, again, most importantly, payroll. You have your own payroll coordinator. They make sure that you've put in your time correctly. Make sure that you're going to get paid that Friday. So as Courtney said, we understand there's a lot of choices out there. And again, what sets CompHealth apart? Well, we believe it's that CompHealth experience. So here's Dr. Arthi Chalwa's reason for working with CompHealth.
I love my recruiter, Camille. Camille has my back. I feel like she genuinely has my interests at heart. I feel like she listens to me. Even before we signed on to my first job, I had spent hours on the phone with her and spent a lot of time emailing back and forth, and I know that she wasn't getting paid for the time that she was just talking to me and educating me about locums. So talking to a real person is amazing because we develop a relationship, and I'm the kind of person that I value relationships a lot. And being able to build a relationship with Camille has made this experience just so much better. She knows exactly what I want and what I don't want, and we work well together. If there's something that happens that I'm unhappy with, I let her know, and she does a lot to fix it.
And I think that's what it all comes down to is developing relationships. And that's something that really sets us apart. I love how she said about her recruiter, Camille, how she really listens to her. And I think that's key, because when you're not just a number, we really do take the time to listen and find your whys and your goals. And that's important to us. So here's some resources. We hope you find this useful. You've got some really fun ones like the one Courtney mentioned earlier on From Residency to the Open Road by Dr. Trevor Cabrera. That's on our Locum Story, and you can learn more about how he's traveling around and using locums to do that. And more about his adventures. You've also got some practical resources there, like negotiating your physician contract or writing a CV. So feel free to look at those resources. If there's anything that's missing, though, feel free to reach out to Courtney and I, and I'm sure we can find those resources for you. So what's the next step? We'd love to chat with you. If you'd like to explore more about how locum tenens may be able to fit into your schedule, whether that's now or you feel like, hey, maybe I'll do this later on down the road. We'd love to chat with you. We want to be a source of information for you. So feel free to go ahead and schedule a call with us. You can click on either one of our Calendly links there, and you can schedule a discovery call with us for a day and time that's going to work best for you. I'll also follow up this webinar with an email thanking you for attending, and I'll include our phone numbers and emails in that as well.
Yes, and just another side note on that, if you're wanting to schedule a discovery call, we want you to know that we completely understand how important family is and how big of a decision it can also be to work locums and consider traveling and leaving loved ones behind. So we always encourage, also invite, if you have, a family member, a significant other, someone that would like to join you on the call, we could do a phone call with them present, or we could even schedule a Zoom call. But we welcome you to invite your family. And we've had a lot of families travel together on assignment. So Sarah, I was going to say that's definitely something that both you have done in the past, and we welcome it.
Yeah, absolutely. I love when spouses join because spouses have the best questions. Absolutely. It's super fun. And that's what one of the CompHealth's core values, right? We're family. So absolutely. Yeah.
And so we get it. It's a big deal if you're got little ones that you're leaving or.
Absolutely. Absolutely. So we're happy to explain to you more about how that works. Awesome. Well, that brings us to the end of today's webinar. Again, we want to thank you so much. We know that this is a busy time of year for you. You're wrapping things up. It's exciting, but it's stressful. So we appreciate the time that you spent with us today. If anyone has any questions, we're happy to answer them right now. I didn't see any questions pop up in the chat. Did I miss anything, Courtney?
I didn't see any either.
Okay. Well, feel free to, reach out to us with any additional questions. You can email us, give us a call, or set up that discovery call, and we're happy to chat with you at another day.
Yes. Thank you. Thanks.
Thank you. Thanks. Bye.